Dr. Traci Hefner, apologies, from the Chattanooga Community Kitchen. She's Director of Case Management.
One of the things I hate about presenting is us. Sorry.
Yeah, no, there you go. We can hear you and we can see you. So she's going to talk about health disparities among our homeless folks. So thank you, Traci. Appreciate you being here. And
you're welcome. I'm setting my phone for 15 minutes. We'll see. If the buzzer goes off, I'll stop talking. Well, hello, everybody. Thank you very much for having me. I'm very excited to be talking about health disparities among persons experiencing homelessness in the Housing First model. As Amber said, my name is Traci Hefner, and I am the Director of Case Management at the Chattanooga Community Kitchen. And we believe here, as I'm sure you all believe, that housing is a human right, and that homelessness is also a public health issue. And at the Community Kitchen, our mission here is to meet the basic needs of people who are hungry, homeless, and vulnerable in our community, and offering them a clear path to self-sufficiency. And this is vitally important. This is basically why I even came here to work. And how do we meet this mission? We meet this mission in a variety of ways. We have a very comprehensive range of services that we provide to meet the health and safety needs of people as best we possibly can. We serve 3 meals a day, 7 days a week, because hunger and food insecurity is a major issue among people that are experiencing homelessness. We have a day center that is a place where people can come in and out of the weather. They can do their laundry, they can take showers, they can use the phone, talk to a job coach, and they can even get foot care from students in your nursing department, a vital service that you all provide to our community. We have a thrift shop where people can buy shoes, clothing, any items that they may need. We have an emergency shelter for families where we can house up to 13 families at a time who are experiencing homelessness. We also provide a winter warming shelter to save lives during the coldest parts of the year, November through March. And finally, we have case management services, and we provide assistance for people who are in jeopardy of becoming homeless by helping with rental arrears, helping people who are currently homeless to find housing, and then also doing outreach for people in the over 100 homeless encampments that are in Chattanooga to provide them with items that are needed and to provide transport to appointments for them. So this is a range of complex services that we provide to best support the population that we serve. But before delving into our service model, I would like to show you some numbers because I think some of these numbers are very important to show the need in Chattanooga and the surrounding area. So based on last year's point in time count, which is a count that takes place every year to give an estimate of the number of homeless people within a community, and it's going on right now, there are almost 1,500 people who were experiencing homelessness in Chattanooga and the surrounding area. Unfortunately, we think that we are going to see a significant increase in that number this year. Of those people that are experiencing homelessness, we try to help as many as we can. And here we have some numbers. We have helped so far within the last 9 months about 37 people to get into housing through our rapid rehousing program. That may seem like a small number, but that has been a monumental task to try to get people into housing in Chattanooga. We have also assisted 88 households in terms of homeless prevention. So we've paid up to 6 months of rental arrears for folks so they would not become homeless. We have 27 families and individuals in our own housing. We have an apartment building where we have 10 families in our apartment complex. And then we also have 3 other homes where we have housing for men and for women. In our shelter just last year, we served 110 families. And on any given month, we serve 15,000 meals. So there's a huge need, unfortunately. And if you walk down 11th Street, the needs are just very visible at this point. Even more so than just a year ago, there are tents and people everywhere at this point. And the needs, unfortunately, outweigh the resources that we have. And on any given day, my staff or myself, or somebody comes up to us and they'll say, can you please help me? You don't know what I'm going through. And we will say, you're right, we don't, but please tell us what you're going through. It is important that we, and when I say we, I mean us as a community, see the homeless, that we listen to them, that we talk with them, that we understand their stories, their needs, and their wants. We had an individual come into our center the other day who was crying. Staff person walked up to her, asked her what was going on, and she kept saying over and over again, I'm a person. So these are real issues that are happening, and they're right here in our front and back doors at this point. So the folks that we serve have a broad range of complex issues. There are trauma histories. We have folks that have had untreated and inconsistent mental health treatment. We have substance abuse issue, social disconnection, unemployment, exposure to all types of violence, and poor health. And these social determinants contribute to and even exacerbate the health concerns of the homeless population. They are more likely to have higher morbidity, and they also have a shorter life expectancy. I believe the average that we see is probably around 50 years, 20 to 30 years less than a housed person. Last year alone, we lost 119 people. There was a 33% increase in the number from the previous year. So it's a dire situation at this point. So what can we do? The good news is that we know what to do. And what to do is housing. Housing is an intervention that we know works. Housing can help to reduce the litany of problems that people who are facing homelessness experience. Research demonstrates that the access to housing is a basic social determinant to health. And it also improves other outcomes in areas such as their increased likelihood in job participation, or they're more likely to discontinue substance use, or they may even require fewer days in a hospital if they're admitted. So these are all very important things surrounding housing. At the kitchen, we use the Housing First model. And the Housing First model was first introduced in the late 1980s. And it is a model that focuses on getting persons experienced with homelessness into permanent housing without any conditions. So somebody does not have to already be in a mental health treatment. They don't have to be in a substance abuse treatment center. We will get them into housing first. The goal is to get them into housing, get them stabilized, and then we start to provide intensive trauma-based case management services around them. So to make sure that they're going from homelessness to transitioning into housing to stability in housing. That is our goal here. It's a goal that often works. One of our biggest barriers, whoops, just to move on the PowerPoint here, sorry. So one of our biggest barriers, though, is finding affordable housing, as I think one of the first speakers talked about this morning. Finding affordable housing can be very difficult. We actually have a full-time housing navigator whose job it is to meet with landlords and property managers and talk about our program and the needs and how they can actually help with the social issue and make a difference in people's lives. And that is working, and that's very important. But we also face other barriers. We face criminal records. So we're often going to court trying to get records expunged, writing letters, doing everything we possibly can to get people into housing. People often have eviction histories or owe money to public housing, which stops them from getting into places. But often we say that getting them into housing is the easy part of our job. The difficult part of our job is making sure that people stay in that housing. And that's where those intensive case management services come into play at that point. And we do have a lot of successes. And just to give you an example, we have a success with a gentleman who had been on the streets for many years. He was what they would consider chronically homeless. Chronically homeless, according to the federal definition that we have to adhere to, means that you have been homeless for 12 consecutive months, or you've had 3 episodes of homelessness within, 4 episodes of homelessness within 3 years. So this was a gentleman that had been out on the streets for a long time. He suffered from alcoholism, depression, anxiety, chronic health issues. We finally got him into housing. He is in housing and shared housing, so he has a roommate, and he is doing well. There have been bumps along the road, I'll admit that, but that's why you're providing intensive case management services. Today, he is able to manage his money. He's on fixed income, but he's able to manage his money. He pays his rent on time. He is socially connected at this point. He is able to take transportation. He takes the bus. He's able to go to his doctor's appointments, less likely to go to get his mental health treatments, but that's something that we're continuing to work on. But he's living life the way he should at this point. He's being successful. He's being self-sufficient, which goes right back to what our mission is, helping people to become self-sufficient. But unfortunately, we also have some failures, and these are the ones that are very, very difficult. Just last month, we had a gentleman that passed away. He was a gentleman that we were working on getting into housing. He had renal failure and a number of other health issues. He was 57 years old. We had worked on a number of different ways to try to get him to go to dialysis. He just wasn't going. And then getting somebody into housing can be a process because of all the federal guidelines and everything that we have to adhere to. But we got him into housing, we got him approved. And on a Friday, he signed the lease. We were so excited. And as he's signing the lease, he said to me, he said, I'm going to be able to sleep in, because he had been staying at an emergency shelter. In an emergency shelter, you have to get up at 6 o'clock in the morning and you have to be out. And this is somebody with serious health issues. And so he would go out of the shelter and he would come up to the kitchen and he would sit here all day until it was time for him to go back to the shelter. So the goal was for him to move in to his apartment on Monday. But unfortunately, on that Sunday, his health was beginning to fail. And the staff at the shelter called EMS. They took him to the hospital, and a few hours later, he passed. It was a really hard day for all of us. There was another gentleman who was at the shelter who came up to me on Monday, that following Monday, and said, you know what? He didn't die on the street, and he had an address. He did good. But it's all perspective, right? All perspective. So there is good news though. And the good news is that even though we have barriers and there are setbacks, I've only been in Chattanooga for a year, and I have found that Chattanooga is a very warm and welcoming community. So there is hope. And I think that people want to know what is needed. And so whenever we can, we talk about what we feel that is needed. And of course, affordable housing is number one. We need affordable housing in Chattanooga. Without that, we're not going to be able to do the intervention that is so necessary for these individuals. We also need a low barrier shelter in Chattanooga as well. If the only place we really have for people to go is the rescue mission, which is wonderful that it's there, but it can only serve so many people, and we have a far greater need. And if you're in a wheelchair, you can't go, so you're out on the street. You end up being on 11th Street. It's just not acceptable. We need a youth shelter in Chattanooga. We are seeing more and more youth come here. We have Greyhound that is now dropping off and picking up people, I think, one street over. So we're starting to see a lot more people from different states, Miami or Florida, Indiana, Ohio, and a lot more youth here. So we need to have those youth services as well. And then we have to have systems that are not overwhelmed. I'm on these crisis calls for crisis response, and everybody is talking about how overwhelmed our systems are at this point. And that makes it even more difficult then for our folks to get the services that they need. So it's very, very important that all these things were addressed. But there is hope still. So what can you do? This is what people ask a lot. What can you do? Would just be listening to this. You are educating yourself on homelessness and continuing to do so. I think that is vitally important. Donate to local agencies that are serving the homeless population. On our website, we always have a list of items that we need, and they will be put to good use. Advocate for the community needs, the shelters and everything else that we need with your local representatives. You know, writing letters, picking up the phone. They often say it only takes 6 people to make a difference, and we can get some things passed. Very, very important. Or you can volunteer at the kitchen. We love to have volunteers. You can come down here, volunteer, and meet the people, and do some good work, and we appreciate it. Did it in 15 minutes. Sorry if I was talking really fast. I was looking at this, I was getting worried.
I'm impressed. You did a great job. Did you cover everything you wanted to cover though? I mean, you're like literally, you did. That was very impressive.
Well, thank you all for having me. I really appreciate it. I appreciate your time.
And thank you very much. Appreciate, you know, just really all of our community agencies, all of the work you all are doing is amazing. There is so much overlap, which just goes to show how much of a need there is in our community to have all these different agencies doing duplicate work because we have so many people who need it. So yes, thank you very much. Appreciate your presenting. Very good information. Okay, so our last but not least presenter is from the Chattanooga Area Food Bank. It's Sarah Beth Riggs.